Look at your fingernails for just a moment. Now press firmly on one nail for 2 seconds, then let go. Watch how fast the pink color returns. That tiny test can reveal something important about your circulation. Doctors call it capillary refill, and it can give a quick clue about how well blood is moving through the smallest vessels in your body. But that is only one sign. There are 3 other nail changes that many adults over 60 never learn to check. And together, these signs may point toward circulation problems, oxygen problems, anemia, or cardiovascular stress before the symptoms become dramatic. I'm Dr. Ben Walker, and today I want to show you 4 nail signs you should not ignore after 60. The 4th one is especially overlooked because most people have seen it their whole life but never knew it had a name. Before we go further, remember, this video is for education only. It cannot diagnose you, but it can help you know when to speak with your doctor. Your nails may look simple, but biologically, they are connected to something very active inside your body. Every nail grows from an area called the nail matrix. This is the living tissue near the base of the nail, hidden partly under the skin. The nail matrix needs a constant supply of oxygen, nutrients, and healthy blood flow to keep producing strong nail tissue. Under your nail bed are tiny blood vessels called capillaries. These are some of the smallest vessels in your entire body. Because they are so small, they can sometimes show early signs when blood flow, oxygen delivery, or circulation begins to change. This is why doctors sometimes look at nails, skin color, and capillary refill when assessing circulation. Now, this does not mean every nail change is dangerous. Nails can change because of aging, injury, fungus, dryness, cold weather, chemicals, low nutrition, or many other reasons. But after 60, nail changes deserve more attention. Why? Because the risk of heart disease, blood vessel disease, anemia, lung disease, and circulation problems increases with age. And sometimes, the body does not send loud warning signals at first. There may be no chest pain, no collapse, no dramatic event. Sometimes the early clues are quiet. A little color change, slower blood return, cold fingers, nails that suddenly become weak, a small half-moon shape that fades away. Most people ignore these signs because they assume, I'm just getting older. But getting older should not mean ignoring your body. So let's go through the 4 signs one by one. Sign number 1 is a bluish or purplish color in the nail bed. Doctors call this cyanosis. Cyanosis means a part of the body is looking blue or purple because the blood in that area may not be carrying enough oxygen, or because circulation to that area is reduced. Now, there is a very important difference you need to understand. If the blue or purple color is mainly in your fingertips, toenails, hands, or feet, while your lips and tongue still look normal, this may be peripheral cyanosis. That often points more towards circulation in the extremities. But if the blue color appears on your lips, tongue, gums, or inside your mouth, that can be central cyanosis. That is more serious because it can mean oxygen levels in the blood are too low due to a heart, lung, or blood problem. Central cyanosis can be an emergency. So here is the simple way to think about it. Blue nails that happen only when your hands are cold and then improve when your hands warm up may not be dangerous. But blue or purple nail beds that keep returning, especially when your hands are warm, should be discussed with a doctor. And blue lips or blue tongue should not be ignored. Imagine a man in his late 60s who notices that the base of his nails looks slightly purple every morning. He thinks it is just age. He thinks maybe his hands are cold. He says nothing for months. Then his daughter notices it in daylight and asks, "Dad, have your nails always looked like that?" That one question finally pushes him to mention it at his next appointment. His doctor checks his heart and lungs, reviews his symptoms, and orders further testing. That is the power of noticing. You are not diagnosing yourself. You are giving your doctor a clue. So check your nails in good natural light. Look near the base of the nail and through the nail bed. Ask yourself, is the color pink, or does it look blue, gray, or purple? If it looks abnormal and does not improve with warming your hands, bring it up. And if you notice blue color on the lips, tongue, or inside the mouth, especially with shortness of breath, chest pain, confusion, or weakness, seek urgent medical care. Sign number 2 is brittle nails that suddenly become weak, slow growing, or easy to split. Now, brittle nails are very common. They can happen because of dryness, repeated washing, cleaning chemicals, nail polish removers, low thyroid, low iron, fungal infection, or normal aging. But there is a pattern that matters after 60. If your nails become noticeably weaker over the last year or two, and at the same time your hands or feet feel cold, and your legs cramp or feel heavy when you walk, that combination deserves attention. Why? Because one possible cause is poor circulation. A condition called peripheral artery disease, or PAD, happens when arteries that carry blood to the legs and extremities become narrowed by plaque buildup. This can reduce blood flow to the feet, legs, and sometimes other extremities. The classic PAD symptom is leg pain, heaviness, aching, or cramping during walking or climbing stairs that improves when you stop and rest. Doctors call this claudication. Many people miss it because they simply walk less. They think, "My legs are just tired." They avoid hills. They avoid stairs. They stop doing the things that trigger the symptom. But the arteries may be telling a story, and when blood flow is reduced, the nails may grow more slowly, become more fragile, or look less healthy because the tissues are not getting the same steady supply they used to get. Picture a woman in her early 70s who loves gardening. Her nails start splitting and peeling. She blames the soil, dry weather, and age. Then she notices her legs feel heavy when she walks uphill. She stops halfway, rests, and the heaviness goes away. That pattern is important. At her checkup, she mentions both symptoms together: brittle nails and leg heaviness with walking. Her doctor performs a simple test called an ankle brachial index, or ABI. This compares blood pressure at the ankle with blood pressure in the arm and can help detect peripheral artery disease. That is the kind of conversation that can change the direction of someone's health. So here is your practical takeaway. If your nails have become brittle or slow growing, do not panic. Look for the pattern. Do you also have cold feet? Do your legs ache, cramp, or feel heavy when walking? Does it get better when you rest? Do you smoke, have diabetes, high blood pressure, high cholesterol, or a history of heart disease? If yes, ask your doctor whether circulation testing, including an ABI test, may be appropriate. Sign number 3 is slow capillary refill. This is the quick test I asked you to do at the beginning. Let's do it again properly. Hold your hand around the level of your heart. Pick one fingernail. Usually the index finger works well. Press down firmly on the nail until the nail bed turns pale or white. Hold for about 2 seconds. Then let go. Now count how long it takes for the normal pink color to return. 1 second, 2 seconds, 3 seconds. In many healthy adults, the color returns quickly, usually within a couple of seconds. But refill time can vary. Older adults may sometimes take longer. Cold hands, room temperature, dehydration, certain medicines, and poor lighting can all affect the result. So do not test once with cold hands and panic. Warm your hands first. Sit in a warm room. Try the test on several fingers. Compare both hands. If the refill repeatedly seems slow across multiple fingers, especially if your hands are warm, that can be a sign of reduced peripheral circulation or poor blood flow to the small vessels. Again, this is not a diagnosis, it is a clue. Doctors use capillary refill as one piece of a larger picture. They also consider your pulse, blood pressure, oxygen levels, temperature, symptoms, medications, and medical history. But this test is useful because it gives you something observable. Imagine a retired man who tries the test one evening. He presses the nail, lets go, and counts almost 5 seconds before the color returns. He thinks he did it wrong. So he tries another finger. Same result. Then the other hand. Same result. The next morning he calls his doctor and says, "My fingers are warm, but the color takes several seconds to come back." That statement gives the doctor a reason to ask more questions. Are you short of breath? Any chest discomfort? Any dizziness? Any irregular heartbeat? Any swelling in the legs? Any history of diabetes, heart disease, or smoking? This is how small observations become useful medical conversations. So try the test today, but do it correctly. Warm hands, good light, several fingers, both hands. If the color return is consistently delayed, write it down.
Note the approximate seconds. Mention it at your appointment, especially if you also have cold hands, blue nail color, dizziness, shortness of breath, leg cramps, or heart rhythm symptoms. Sign number 4 is a change in the lunula. The lunula is the small pale half-moon shape near the base of some nails, just above the cuticle. Look at your thumb right now.
Do you see a small white crescent? That is the lunula. Most people have visible lunulas on the thumbs. Some have them on the index fingers and middle fingers. Many people do not have a visible lunula on the pinky, and that can be normal. So the absence of a lunula on one finger does not automatically mean something is wrong. What matters more is change. If you used to clearly see the half moons on your thumbs and index fingers, and now they have faded dramatically, or if the color has changed, that may be worth discussing with a doctor. Very pale nails or fading nail features can sometimes be linked with anemia or circulation changes. A bluish tone may connect with oxygen or circulation concerns. Redness in the nail base or unusual nail bed changes can sometimes appear with inflammatory or systemic conditions. But you have to be careful here. The lunula is not a magic diagnostic tool. You cannot look at it and say, "I have this disease." That would be irresponsible. Instead, treat it as one more signal. If the lunula changes along with fatigue, shortness of breath, dizziness, chest symptoms, cold extremities, nail color changes, or slow capillary refill, it becomes more meaningful. Think of a grandmother who notices the little white half-moons on her nails have almost disappeared. She laughs it off. Later she tells her daughter, who is a nurse. Her daughter says, "Mention it at your physical." The doctor orders basic blood work, including a complete blood count. The test shows anemia that had been developing slowly. Further evaluation helps find the cause, and treatment begins before the symptoms become worse. The nail change did not diagnose her, but it helped start the conversation. That is exactly how you should use this information. Not fear, not self-diagnosis. Observation, documentation, conversation. Now let's put all 4 signs together. Today, stand near a window with natural light and look at both hands. First, check the color of the nail beds. Are they pink, or do they look blue, gray, or purple? Second, look at the texture and strength. Have your nails become unusually brittle, cracked, peeling, or slow growing compared with your normal? Third, do the capillary refill test. Press the nail, release, and count how long the pink color takes to return. Fourth, look at the lunula, the half moon at the base of the nail. Is it visible on your thumbs? Has it changed from what you remember? Does the color look unusual? Then take a photo of both hands in good light. This is simple but powerful. A photo gives you a record. It helps you see whether something is changing over weeks or months. It also helps your doctor understand what you are seeing. If you notice one mild change, do not panic. But if you notice 2 or more signs together, or if the signs are new, persistent, or getting worse, call your doctor's office and ask whether you should be seen sooner. And if you notice blue lips, blue tongue, severe shortness of breath, chest pain, fainting, confusion, sudden weakness, or severe symptoms, do not wait for a routine appointment. Seek emergency help. Here is the message I want you to remember. Your nails are not just decoration. They grow from living tissue. They depend on oxygen, nutrients, and blood flow. And sometimes, especially after 60, they can show clues about what is happening inside your body. But a clue is not a diagnosis. A nail sign should never replace medical testing. It should guide you toward the right questions. Ask your doctor, could this be circulation related? Should I have blood work? Should we check for anemia? Do my symptoms suggest peripheral artery disease? Would an ABI test, EKG, oxygen check, or cardiovascular evaluation make sense for me? These are smart questions. They help you become an active participant in your own health. And that matters, because many serious conditions are easier to manage when they are found earlier. So before this day ends, take 60 seconds and check your nails. Look at the color. Check the strength. Test the refill. Find the lunula. Write down anything unusual. Your body may have been giving you small signals for a long time. Today, you learned how to notice them. If this video helped you, Subscribe for more clear health guidance for adults over 60. And share this with someone you care about, because one small sign noticed early can sometimes lead to one very important conversation.